Hi, I'm Jessica Young. I'm one of the breast surgeons here at Roswell Park Comprehensive Cancer Center. For breast cancer, the most common symptom is not to have any symptoms at all. Most breast cancers are caught on regular screening mammograms, which is why it is just so important to get a yearly screening mammogram. Other signs of breast cancer could include masses that you can feel, nipple discharge or changes to your nipples such as sudden inversion, or changes to the skin with rashes, or changes in contour. A lump in the breast isn't always breast cancer. In fact, there are many benign things that it could be. It could be something like a fibroadenoma or a cyst, or it could even just be some dense tissue. Generally, if changes to the breast go away quickly, then it's probably not indicative of a cancer. Or if you have redness to the skin, it might be indicative of an infection, and if it goes away, then that's okay. But when changes persist, or if things feel like they're growing, then that's certainly a sign that maybe you should have that checked out. Screening mammograms are really important, and really we generally suggest that you start getting your mammograms at the age of 40. However, if you have a family history where you have family members who have had it at an earlier age, then we suggest you actually start screening about 10 years before the age of the first person who had breast cancer. This is really just so that we can catch things as early as is possible, and we really want to be able to find these breast cancers when they're just very tiny and found on mammograms and not when you can feel them. By the time you can feel them, they're probably a little bit on the bigger side. If you have a mass or something that you feel in your breast that hasn't really gone away after a couple of weeks, it's really a good idea to see your physician and have an evaluation for that. Even if you think that you have a mammogram coming up soon or a doctor's appointment in a few months, it's not a bad thing to go ahead and get that checked out sooner rather than later.